Welcome to this training and technical assistance opportunity hosted by the HMA CAREC data team. During this session, we will present guidance for updating and correcting CAREC data for inclusion in the second annual report. During this session, we will provide a brief summary of the slide deck and talking points that accompanied the QA report distribution notification email. We hope you've had a chance to review that deck as it provides in-depth guidance about the cumulative corrections process, both visually on slides and narratively in the talking points. Today, we will just briefly walk through the high points of that deck before opening it up for Q&A. The slide deck will be promptly posted to the CAREC Resource Center and distributed to registrants along with a recording of this session. Joining me today is the whole gang. Here we have the HMA CAREC data team. Serena is our team lead. Lauren is our reporting lead and will facilitate the Q&A portion. My name's Carly and I'm the project manager on our side. And finally, Cha, Jessica, and Bennett are here to represent the analytics team. We hope this can be an interactive session and welcome any and all questions about the cumulative corrections process. If any questions remain after the session, please email us at caredatateam@healthmanagement.com. Now we'll get into some level setting information about the files you've received and the upcoming resubmission deadline. Authorized MoveIt users will see up to 3 files in their DHCS delivery folder on MoveIt. These include a cumulative QA report, which identifies data quality flags for all CARE Act data submitted from the beginning of each county's implementation of CARE Act through Q2 2025. An additional identifier anomaly tab is included for some counties who have CARE participant identifier issues. You may also see a longitudinal data extract. This file represents all of your CARE Act data submitted to date. This file can be corrected and resubmitted to HMA. Counties can also make corrections within their internal systems and resubmit impacted monthly files in a compliant format, meaning either in data file template A or B. Finally, there may be a submission confirmation file. This file will ask counties to update and resubmit to provide additional information on instances where counties may have formally notified us that they did not have data to report for a specific module of the data dictionary. It will also ask all counties to identify which data dictionary version applies to the files that are being resubmitted. More information on each of these files and previews of each of them will be provided in the coming slides. Counties have until December 2nd, 2025 to review these files, make corrections and updates, and resubmit those files back to us using the submission folder on MoveIt. We highly recommend devoting staff time to this process early as this deadline will not be extended again. Data submitted beyond this deadline may not be reflected in the second annual report. QA reports are provided as a tool to support counties in identifying data quality issues. We want to provide a reminder here that the QA reports should not be edited directly and are not one of the files that need to be resubmitted to us. Instead, counties are able to use the provided longitudinal data extract, which includes all of your CARE Act data submitted to date, to make your corrections. For counties that have submitted data exclusively using the data file templates thus far, there is a second option, and that is to make all your corrections within your own system and resubmit impacted monthly files in a compliant format. Again, either data file template A or B. As is the case with other quarterly resubmissions, we ask that you please ensure to include all data from the affected month and not just the corrected records. With that, I'm going to turn it to Jessica, who will tell you a little bit more about the cumulative QA report.
Okay, so now we're going to walk through the QA report file itself. And so pictured on this slide is the first tab of the QA report, which is the summary. And this tab highlights which sections and reporting months need attention. The final column in this summary table shows the QA reporting status. So if the status is accepted, counties do not need to take any further action related to that submission. But if the status is corrections needed, all data for that specific reporting month and section will need to be corrected and resubmitted. In this example on this slide, Corrections are only needed for February and March petitioned individuals data, as well as February system referrals and care inquiries. Next slide, please. All right, the next tab in the QA report is the QA checklist information tab. This tab lists the 11 CART metrics that HMA uses to evaluate County Care Act data. And all QA issues that you will see listed later on in your report are tied to one of these elements. So I'll just briefly walk through these since you can refer to them in greater detail in the QA file. But the first one is file naming convention, which is pretty straightforward. We just check that file submissions and resubmissions are named correctly. The next element is completeness, which encompasses checking for missing data as well as duplicated data. We also check for accuracy of the data, which includes making sure client identifiers are consistent and that the data align with data dictionary value codes and ranges. The next element is reasonableness, which includes logic checks, such as ensuring that an individual's care statuses follow the correct sequence of the care process. And lastly, timeliness refers to the requirement that data must be submitted within 60 days after the end of each reporting quarter. Next slide, please. All right, the next tab is the QA issues summary tab, which lists every data point within each module and whether there are any QA issues associated with each data point. So this tab is intended to give a general sense of which data points are problematic. So when no QA issues are raised for a data point, it'll receive a pass, which is seen here in green. And then when any QA issues are identified for a data point, it will be labeled as fail, seen here in red. Next slide, please. So these next few tabs in the QA report are sort of the core of the QA report as they list out all of the QA issues associated with each module. Counties can use these tabs to identify the records and data points that require correction. On this slide here, we've shown an example of the petitioned individuals issues tab. And I'm going to walk through this example row from left to right to give you an idea of how to interpret this. So if you look in box 1, these columns help identify which reporting month the issue is from. So you can see here that the issue is in the February data for Q1 2025. We also include the care status here to let template A users locate which tab the issue is in. In this example, the status is 5, which is the care agreement tab. And then moving on to box 2, these columns help locate which record requires correction using data points to identify individuals like name, birthday, and petition case number. And then in box 3, these columns help identify which data point in the record requires correction. So the data headers column will tell you the data point, and then the data values column shows the original value that was submitted for that data point. In this case, there is an issue for the age data point. And then since data values is null, that means that age was missing in the original submission. Lastly, here in box 4, these last 2 columns give more detail about the quality issue by indicating which CART metric has failed. So you can see here that the issue is related to C, or completeness. And then we also have an HMA comments column, which just provides additional context or guidance about the QA issue. And then any general issues related to the overall file submission can be found in the File Submission Issues tab. So these include issues like incorrect file naming or use of a template that is missing required data points. Next slide, please. And so this is new for this QA round. Some counties will be receiving another tab in their report called Identifier Anomalies. So this section flags possible inconsistencies in key identifying data points, including name, social security number, medical number, petition case number, sex, and date of birth. And as is with the rest of the QA report, counties should not make corrections to this table itself. Rather, you should review these flagged records and correct them across your full data set. Additionally, if you end up using the provided longitudinal data extract for your resubmission, you'll see that we've included columns to help locate records with identifier anomalies. The extract has a person ID column that corresponds to the one seen here in the identifier anomalies table, as well as another column that can be used to filter for rows with identifier issues. So hopefully those two columns will help you locate and correct these issues. We also would like to recommend fixing identifier anomalies first, since resolving these often clears up other QA issues. With that, did we want to take a little quick break, was it, for some questions, or
Yeah,
move on to?
there are two questions in the chat I think we could probably just quickly clarify before we move on. So the first from Ileana, counties that use the template do not need to submit the longitudinal data file. I do see Cha responded here. Counties can correct the impacted monthly data files, or they can make the correction using the longitudinal data file. Jessica, anything else to add there?
Nothing to add there yet. So if you've only used the templates to date, you can just resubmit using those templates. You do not need to submit the longitudinal data file in addition to that.
Perfect. And then the other question that came in specific to the slides you just presented on, is this going to be a monthly reporting that will need to be submitted on top of the quarterly reporting that we're already submitting? I guess that's another question for you, Jessica.
Is this in reference to, let's see, is this going to be a monthly reporting? In terms of the cumulative QA, so this is just something we do once a year, but we do the quarterly QA rounds. I'm not sure if I understand the question 100%.
Yeah,
Um,
oh, go ahead, Sean.
yeah, so for county, right, they collect and report on a monthly basis, but then they submit those monthly file back to HMA on a quarterly basis, right? Yeah, so when we say quarter, basically that means like, all right, like those monthly file, right? Every quarter you give us 3 monthly file. Yeah. So on the cumulative QA report, we go back from when you first start reporting monthly, and then we look at all the issue from like every single month, right? And then we pinpoint you to like the location, like to which month, which file this issue exists. And then you, like Jessica mentioned, you have two options, right? If you know which month and which file, you can just go to that file, make the correction, and submit that file back to HMA. Or if you prefer, you can use the longitudinal data, which we append everything that you have submitted back to HMA, and you can just make the correction in that single file. Yeah.
Wonderful. And Mia, thanks for shouting out that that is helpful. So appreciate that. Okay.
Right, thank you very much, Jessica. And now I'm just gonna go through the longitudinal data extract very quick. Yeah. So HMA has provided a longitudinal data extract for each county, right? When you look at the DSCS delivery folder inside Move It, along one of those files that you received, one of the files, you're gonna see that it is named longitudinal underscore data underscore extract underscore then your county name, right? That will be your longitudinal data extract file, okay? This data extract file, basically it represents all the key data that has been submitted to HMA up to date. And as mentioned earlier, right, if you choose to use the longitudinal data extract, you can just make correction directly within this file, right? And then as Jessica mentioned earlier, you also have the second option where county can also make correction within their internal system and resubmit the impacted monthly file in a compliant format. Either like template A has been used or either template B has been used, basically, right? On this longitudinal data extract, all the data point has been converted to align with data dictionary version 2.0. So if you choose to go with this option, we want you to basically use DD version 2 to basically make the update, right? Yeah, for the longitudinal data extract file. And for this file, we just want to tell you what will be inside. When you open it up, the first tab, we provide like basic statistic on like all the data you submitted to HMA, right? The second, the third, and the fourth tab, those are going to be the data tab. You have your petition individual, you have your system referral, and you have your care inquiry data, right? So those three tabs are going to be your data tab. And on each of these tabs, all data are included in a single tab, basically, right? Multi-select data points are separated into like their own column, okay? And for demographic data points, county only need like to correct the most recent entry for like the affected individual, okay? Yeah, so that is just a quick brief information about the longitudinal data extract. And with that, I will pass it back to Jessica. Yeah.
Thanks, Cha. So now I'm going to go over the last file that will be included along with the QA report, which is the submission confirmation file. Next slide, please. So the purpose of this file is to just confirm why data was not received for certain months, as well as to indicate the data dictionary versions used in your cumulative resubmission. So in contrast with the QA report file, the submission confirmation file should be edited and updated directly, and then it should be uploaded back to us via the submission move it folder, along with your cumulative resubmission files. So this file has two components. First is the no data confirmation table, and this table will be pre-filled with all the modules and reporting months in which no data was received by HMA from the county. And then so for each row, counties should select the reason no data was submitted for that module and reporting month from the drop-down menus in the highlighted column. If other is selected as the reason, or if there are any additional notes, feel free to use that last column to explain. And then the second portion of this file is the data dictionary version confirmation. In this table, counties should list the file names of any resubmitted files, along with the data dictionary version each file conforms to. An important thing to note here, though, is that we do have some guidelines when it comes to which data dictionary version counties should use in their resubmissions. And so I'm going to go over these in this slide here. We basically created this flow chart here to clarify which data dictionary version counties should use when making corrections. And it's really important to follow these guidelines because the two versions have several differences, as you all know, like value codes and question types. So following this flow chart, you want to start by asking if any care data from your county has been submitted through SurveyMonkey. And if the answer is yes, then you must use the longitudinal data extract for your cumulative resubmission and make corrections in compliance with Data Dictionary version 2, since the extract is already in that format. But if your county has exclusively used file templates to submit care data, then you have a choice. You can either use the data extract provided or the original templates. Once again, if you do use the data extract, you must make corrections in Data Dictionary version 2 format. But if you use the original templates, you may correct the data using the version that matches the file being updated. So for example, if the Q4 2024 data in your system has remained in version 1 format, then you should make corrections to this data in alignment with version 1. And so with that, I'm going to pass it back to Carly to go over the submission process.
All right. Now that you have all that knowledge about each of the files you could have received, let's talk through the resubmission requirements, deadlines, and some upcoming additional support opportunities. Again, resubmissions are due back to us by December 2nd, 2025. We please ask that you adhere to the file naming conventions listed here for your CARE Act data files, as well as your submission confirmation files. It's very important to adhere to these file naming conventions so we can kind of easily identify which files have been resubmitted and by whom. I will place these in chat in a moment. Here, we want to flag that in addition to an extension for resubmissions to December 2nd, we have also issued an extension for the Q3 2025 initial submission deadline to allow all of you to dedicate as much staff time as possible to these cumulative resubmissions instead of having to split staff time between both. As stated, resubmissions due back to us December 2nd, and the Q3 2025 initial submissions are now due back to us on December 15th, 2025, instead of November 29th, 2025. In addition to this training, the HMA CARE Act data team is available to take your questions and offer support, first via biweekly data office hours, and in addition to one-on-one technical assistance. We can either take your questions directly via email and correspond with you that way, or you are welcome to request a one-on-one meeting with us to review your files and questions in detail. With that, I am going to pass it to Lauren, who's going to facilitate our Q&A.
Awesome. Thank you so much. So we have a couple questions that came in, but we did first want to tee up a question that we got during registration from someone from a county. So perfect. Thanks, Carly. And then we'll go through your questions one by one, and also have time to just kind of open it up if you want to come off mute and ask your questions there as well. So the question that we received was, if counties need to prioritize corrections to meet the deadline for resubmission, where should they be focusing their efforts? And so we thought this was a good opportunity to kind of highlight how we're using this longitudinal data set. So this longitudinal data set is really being used to create the second annual report, the second CARE Act annual report, which is a yearly or annual report that's put out really focused on CARE Act implementation by counties, but also identifying successes of the CARE Act and all the great work that counties have put in to affect affect outcomes for this population. And what's exciting about this second annual report is that, for the first annual report, we just had a few months of data really, and it was the first cohort and it was the first 9 months of implementation. And there was very little we could do in terms of telling a larger story about outcomes that folks may have been able to achieve in the short period. Actually, most of the folks that were involved in CARE at that point had only contributed about 3 months in the CARE program. And so it was really, it was a story about early implementation, but we really couldn't tell a more nuanced story. And what's exciting about this next annual report is we have much more data. We have all counties implementing at this point. And so the story that we can tell is going to be much more rich and robust. But of course, telling that story really requires, counties to provide as comprehensive a set of data as possible to us, and really work on that systematic missingness and that unknown data that we've seen in some of the submissions. Really because that data could skew the story we're interested in telling and not really highlight your efforts. So for those counties that may be in a position where they have substantial deficiencies or more deficiencies in their cumulative data set, and they need to think about prioritizing efforts due to resourcing or otherwise. We have thought through some guidance here. So first, of course, if there's any challenges with your identifiers, that's obviously a priority area to get those fixed. Next, among care participants, telling the most comprehensive story we can about the services and supports that they've received during the care process, how the unmet needs or, ED visits, hospitalizations, LPS holds, law enforcement encounters, telling the story about how those things have changed over time that they've had in care, housing status, medication, stabilizing medication prescriptions. All of those things are really important for telling that story about how care participants are accessing services and supports while in care, and really what the outcomes of those are. Another thing that's really important is opportunities that counties have had to raise awareness about care and ensure that the folks that are care eligible are getting into care, or those that may not be eligible are receiving other services and supports that meet their needs. And so rationale as to why someone might be care ineligible, services and supports that are being provided to folks that have been diverted away from care, those are really important to include. And then the last thing is the upstream efforts. So over the last, since the early part of this year, those upstream efforts that you all have put a lot of work into in terms of outreach and engagement for service delivery, well, after someone is petitioned, but before they have a disposition assigned, is an area of high interest. Also care inquiries. So, folks that are reaching out to you at the county, asking questions about care, and kind of what types of questions are asking, what are the outcomes of those, is very important. And then system referrals. So not only the outreach and engagement to those system referred individuals, but how are those folks faring? What outcomes did they achieve? Or did they get petitioned to care or other services and supports through the county? That's another area of great interest that we'd love to tell the story about. If there really is systematic missingness and you really are not able to access certain data, even in this resubmission period, we do ask that you try to provide as much detail to us as to why as possible in that QA report. Having a little bit more information as to why this data isn't flowing or why you haven't been able to include it will be really important to make sure that we're messaging in the annual report if there's missingness or if the results seem to be skewed due to missingness, that we can tell a story about, what the counties have been doing, what you all have been doing to try to get that data, or where some of the challenges have been. And that has a spot in this report as well. So I think overall, trying to just prioritize the things that are going to tell the best story possible about all the hard work that you all have been putting into this program over the last couple of years. Any questions on this? And then there are quite a bit of questions that have come through that we want to get to. Okay. So I'll open up a couple of the questions we got. I see that a number of them were already answered, which is great after that first section. Carrie, you had put in a question about requirements for documentation from the counties. So is HMA expecting any potential data review audits or anything like that? I'm happy to take this one, and then we might want to follow up with you if this doesn't exactly answer your question. But counties should be obviously keeping a longitudinal record themselves of data that has been submitted for CARE Act reporting. To our knowledge, we don't know of any planned, audits or anything like that, but certainly, keeping good documentation of your data is the best practice. Is there something in particular that?
Well, I think it was in making our decision about how we were going to approach the insane amount of corrections that we have to make by December 2nd. While we wholeheartedly appreciate the push on the due dates, I mean, it still doesn't afford us the ability to not focus on the submission that's coming up in December and this at the same time. It's still, it's still a small team. We have to focus on this. But I think it was about whether we had our care teams update data directly into that QA file, which would mean that we wouldn't have the backup like forms basically that they fill out in our systems that would kind of substantiate what we put in that. But that comes with a whole host of other issues like refresh and data pull and, and to be honest with you, our system still has not been updated to Capture 2.0. So we're having like the amount of manual work that Samantha and her poor little team are trying to do is just it feels insurmountable. I think every submission, every correction piece. So and also when you're doing a lot of manual kind of putting of data in there, you're likely to get some errors, right? Like if we for some reason put in data on one row up or something like that, then we're hosed for the rest of the document. So it just gets magnified. So I think it was around that, Lauren. It was just about trying to figure out our approach, whether I think Sam and I are inclined to have them edit certain fields in that QA longitudinal document, which will become our golden source of data. That's what we did with the last QM review. That was last year, but Sam and I just had a conversation this morning to make sure that golden source is translated over into this golden source, because you're not going to be able to go to our like assessments, our native system where we collect the data to find those, because we corrected it in the golden source QM correction file. So that's where it was coming from. I don't know if that changes your answer. The only worry we would have is if, a lot of counties have been through some of the, performance measures validations that we're going through for eCuro. And the amount of documentation and code and things like that we've had to put forth is just a lot. So I'm probably me having a little PTSD about that and making sure nobody's going to come back and say, oh my gosh, did you just make up this data or where did you get it from? We're not making it up, but yeah.
Yeah, that's a tricky spot. I don't know if it changes my answer, but I totally, this helps me understand a little bit more where you're coming from. I don't know if we can give, formal guidance on, which to update first, but
Yeah.
I do think it makes sense to try to create one, golden standard, as you say, and then maybe work backwards to make sure that's integrated. And then, of course, every year there will be an opportunity for another cumulative data review. So, if you did end up flagging something over the year, as you're doing further documentation, that could always be included in the next one as well. Which I know is not a perfect system, but, just working in reality like you are.
Yeah, no, I think, seeing as you've come back around a second time, I don't know why we didn't think that would happen again, but that I think now we know there'll be a QM kind of file review at some point. So we'll, adjust for that as time goes forward. But yeah, so it's just kind of, that's where it was coming from.
Yeah, no, I appreciate that extra insight there. That's helpful.
Yeah, so I think our strategy is going to be missing data first. So like this complete months that we don't have reported for a client, we're focusing on that. And then of course, I don't have any problem saying that slide was about us, because we asked you, like, we have over 12,000 errors to fix. So where should we start? We can't do it all. But it's good to know kind of, I think the things that you're going to focus on, especially that because 2.0 wasn't included at all in the last report, obviously.
Right.
But I think there's going to be still deficits, I think, just because of the time it takes to develop the systems to make the changes in 2.0. And we just haven't, the county hasn't, we haven't had the resources to make changes to our native data system.
Yeah,
So.
Kara, can I just jump in real quick? I really
Sure.
appreciate sort of, the transparency here. And I think to Lauren's earlier point, as much as you all can help us contextualize what we're seeing, right? So and I think some of you may have heard me present at the regional meetings recently, we are having counties who are missing like full months of data, like you're mentioning, right, Kara, especially for the new modules like care inquiries and system referrals. It would be so important for you all to either refresh the data or let us know why exactly those were challenges to report, right? I think we've heard anecdotally there are either, data flow issues, data collection issues, or what have you. It would help us contextualize that? Because sometimes it's hard to tell you if you truly had no inquiries, or was it that you had challenges with pulling data from multiple sources together to report them, because they mean very different things.
I think it's a little bit of both.
Yeah.
Yeah, I think it's a little bit
Yeah.
of both. I mean, care is one program, honestly, a small program in relation to the whole system that we have. And so to set up, but the data requirements are as if it's this really big part of what we do, because it just takes the amount of time to dedicate to that. And I think it's just, I don't want to, and we've actually gone against kind of our principles for what we set up normally across the system for care court, just because we've had to adhere to the stuff, and there's legislative mandates. There's also fear that we have about obviously at some point being sanctioned for not having data pieces, all of that kind of is at play. But I think as a whole, we collect system referrals or inquiries from a lot of different places, right? Like when people request services from the county, when people refer in from a hospital, they're not necessarily referring in directly to the care team. So it's like it's tracking that down, but it's also building the systems and altering it for like the new data elements. We haven't been able to do that. So even what we do give you, I think there's still going to be missing pieces, because either we can't get the data source, or we can't crosswalk it into a data dictionary 2.0 value. So it ends up being unknown.
So it
because
represents an undercount is what I'm hearing, right?
Sure. Yeah, because I don't think somebody's having to make the decision about what the value we have in our system, what value it maps to for the data dictionary 2.0. And honestly, I've done some of that decision making for some of the data fields, and I don't feel comfortable choosing, like if our data field is referred to not the right level, referred to a higher lower level of care, but I need to give you whether they went to a higher or a lower level. I can't figure it out, right? So things like that. It's just I would rather choose unknown than to make a mistake the other way. And some of that comes from not knowing how the data is going to be used or how exactly need to be. So, yeah.
Yeah, we appreciate the insight.
All right, well, I'd like to get to a couple more of these questions that have come in. There's one from Samantha. So we'll so the question is, if there are multiple demographic issues on multiple rows for the same client, do we now only need to update the latest demographics row so it has the most updated information? Ben, I think you're able to come off mute and answer that.
Yep. Yeah, so there's two answers to this question. I think if there are no anomaly issues or identifier anomalies identified, it'll be safe to fix the most recent demographic. But if there are identifier issues identified, it might be a little bit dangerous to focus just on the most recent record, because what we've seen is that sometimes, the multiple demographics might be a function of the wrong demographic was accidentally picked for one record, and then it was correct for everything else. Or sometimes we've seen cases where the right information was entered for the person, but the wrong identifiers were added to it, and so it's because there's those two processes for kind of getting the same outcome. I'm hesitant to focus on the most recent record, but if you don't have any identifier anomalies identified, basically that third tab is missing, then you can focus on the most recent record, and that'll be okay. I hope that helps.
By the most recent record, do you mean like what we would be submitting on December 15th? Or do you mean just in that cube file?
I Can I ask Samantha?
Yeah,
so for me,
I
most
was-
recent record. Oh, sorry.
I'm sorry, I was referring to the cum file. So as we're making corrections, if there's demographic, like for example, if there's demographic, if one client has like 10 entries, right, 10 rows of data, because there's 10 months of data we reported, and there's a couple of issues throughout, and there's no anomalies that were identified for this particular client, rather than going through to each and every row and correcting those demographics, is it safe to just go to the last row and correct issues. That's what I'm asking. Yeah, and I'm referring to the, sorry, I didn't clarify. I'm referring to the cum file, basically.
Okay, that's how I interpreted it, and I didn't even think of it a different way.
Okay.
Until Kara asked. But a full disclosure, if there are multiple demographics, chances are a anomaly will be identified because what we try to do is sometimes there are differences in names. Like there might be a Johnny Smith or a John Smith, and so we're using fuzzy matching to try to match first and last names, and then we use other information that's available, such as age and social security number or Medi-Cal number and petition number to try to verify the match. And so if we have a high degree of confidence that it's the same person, it's just that the name might be slightly misspelled or a nickname that is close enough after kind of like a phonetic transformation of the name. If it's close enough, then like Mick or Mike, like we'll be able to match that if the other information is backed up. So, so when we see male, male, female, female, male, 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 that would probably almost certainly trigger an identifier anomaly. So yeah, so it'd be pretty rare to see multiple combinations and not have the anomaly. I wanted to point that out just so it didn't sound like, oh yeah, it's an easy. Yeah.
Okay. I mean, sometimes there's been issues with like race or there's like disability that, gets
Yeah.
reported and then changed or updated, things like that. That's why
Right.
I'm like,
Oh,
I
yeah.
understand those critical items like social security number, gender, things like that. But yeah, sometimes it's other things as well. So,
Oh yeah,
okay.
yeah. Race and disability we've left alone. That's actually not part of the identifying anomalies because those are very fluid.
I think it's happening because we match data, right, through the client, our county client identifier to pull from our electronic health record. And sometimes there are updates to the electronic health record with name, for example, from 1 month to another. And so, I mean, we'll try to add that, I think, to our QA checks before we send it out the door. But sometimes it's one of those things we don't even think about checking because we're matching and pulling it in, but we've seen it with other things where they'll change a name as they open a new case or whatever. It'll just get changed, updated.
Okay, and then there was one other question in the chat. I wanted to just say it out loud just in case, everyone's not monitoring the chat. The question came from Anrinder. Is there any information available on data sharing restrictions between courts and counties, or is this up to us to determine? And this is coming up in the context of those data discrepancies between a court and county reporting. And so Carly was kind enough to link the FAQ we have on this in the chat. So for those that are interested in this or have the same question, you can find that there. And in general, it's our recommendation that courts and counties do work together, not only for workflow purposes about exchanging data, but also for that reconciliation process and that matching process. I wasn't sure though, Carly, is there anything else you want to speak to? And Amrinder, I don't know if there's any other, additional aspects of that question you want to bring forward.
I just wanted to call attention to something at the bottom of the guidance here is that if the discrepancy can be corrected on the court side, County BH's data is correct, but the courts need to be corrected. The courts will go through their resubmission process and you would not need to make any corrections or like no notations related to that issue. So if it can be corrected on the court side, they can handle it. If it can be corrected on the county side, please make that correction, resubmit it to us.
Yeah, I think that's guidance we followed last time around. But the court said that they corrected on their end, but it looks like they didn't. So we'll just need to go through and like detailed review it. But yeah, hopefully we can get that data from them and just like review it ourselves as well. It'll be up to the meeting though. We'll see.
Conley, can I add something very quick about this? Yeah, regarding the court data and the county data. Yeah. So, I think sometimes it also helps just by looking at the date, right? The date that you provided for the data, right? For example, if you're looking at care plan or care agreement, just making sure that those date when it first reported, it is in the correct correct reporting month. Like some small error can be like this petition become a care agreement back in April, right? But then if you report it and you basically put it in the wrong reporting month, right? They're gonna get counted toward that specific reporting month. So now it doesn't match the court record no more, right? Yeah. So just like making sure like you put it correctly and making sure those dates are correct. Sometimes it can just help right away, right? Yeah. Like petition dismissal, right? If it become a care agreement like back in, for example, like back in like June, but then you report it in April and you report it as a care agreement record, technically it is at the wrong reporting month, right? So in April, you're gonna have a care agreement there, and now the court doesn't have it, right? So looking at those dates can help you like put it in the right place. And from there, sometimes you fix the issue right away. And sometimes like you have to go back to the court to see if they reported correctly or they did not. Yeah.
Thanks, Tra. I also wanted to just mention, I see Carly had popped the full supplemental guide link above. But Carly, I'm wondering if you might be able to just speak to the supplemental guide, let people know if they don't already what's included in that.
Oh, yes.
Carly's baby.
Yes, I will share screen really quick. So it's available both directly on our website and in PDF form, and both are updated pretty regularly. So I'll share how you access it from the CARE Act Data Collection Reporting Resources page. So this is our beautiful CARE Act Data Collection, or this is the general CARE Act Resource Center. If you go under Resource Library, find Data Collection and Reporting Resources, this is our page. I'll zoom in. That probably looks a little small. Some information here on county reimbursement and all of the files that I'm sure you are familiar with, data dictionary, flowcharts, data file templates, but this third kind of major section here on the far left is our supplemental guide for the CARE Act Data Dictionary 2.0. This button up the top allows you to download it as a PDF in case you want to print it out and have it next to you while you're reporting. It could be helpful. But the two main sections here are general reporting guidance and scenario-based data entry guidance. So these are all informed by questions we've received from you all to our inbox or during data office hours. Things like when to begin and discontinue reporting CARE Act data, guidance on collecting on specific data points like criminal justice, reporting on care inquiries, how to report on the one-year status hearing depending on some rules in your county. And if you click into one of these, it'll give you our specific guidance. The scenario-based ones are, again, updated very frequently. What to do if your care participant transitioned into AOT, what to do if your participant's notice of ordered investigation is delayed and there might be some discrepancies in dates, how to report when your care participant's current care status changes. So tons of information in here. We're always looking at our inbox and data office hours questions to update this. So highly recommend taking a look. I'll drop the whole resource center link in chat and you can grab it. And we always put in newsletters and in emails to data contacts when we've updated these. So you'll be notified when there are new fresh things to take a look at.
So we've addressed all the questions. Thanks, Carly. We've addressed all the questions that have come through in the chat. Wanted to make sure, though, there's still time for some others if folks want to come off mute or put anything else in the chat, anything on anyone's mind. I also want to point out, I know this was again addressed in the chat above, but this PowerPoint will be made available through the CARE Act Resource Center. So please look out for it there if you'd like to review this. We also have data office hours later today in about an hour or so. So for any other questions you may have, or if anything else comes to your mind about this in the next hour or so, please feel free to join us there. And the recording, Maria, I believe the recording will also be made available online. Is that right? Yes.
Yep. And a note about data office hours, I just put the registration link in chat. Today, it will be as scheduled. We are planning for an ad hoc session on November 19th. At the same time, we will not be having the session on November 26th, as it's the day before Thanksgiving. So all registrants should have received like an ad hoc special link for the 19th. And if you haven't yet, you will. I'm checking registration links to make sure everybody gets it that should.
I do have a question about the process of corrections. We, in our QA report, there were certain issues identified that when we go back and look at the files that we submitted, we don't understand why it does not. It says that there's no data in there and we see data. So I wonder, what would you recommend? Should we schedule something one-on-one? Could this be addressed in the office hours? It's just, we'd like somebody like Cha maybe to look at this and tell us, what is it? At first I thought that maybe it's because we have a 0 in front of single digit number in some of these cells, but then it is not consistent, because then I found other cells like that that were not flagged as incorrect. So I'm just baffled. So what would you recommend in terms of making these corrections? How should we approach that?
Cha, is this something you can chime in on?
Can I ask which county? Yeah.
Santa Clara County, but I see a note here that somebody else is also confirming that they're noticing the same issue.
Yeah, we're having staff go row by row because we've sent things back to programs and they said, you did enter the information, it's in there. We're
Yeah.
just starting to double check that right now, this morning, that there are things that are marked as missing, but they're on our submission sheets originally for the months. So I'm not sure the volume. I haven't, I don't know like how many, but there are some, and they're for specific column numbers. I have some notes here.
So I'll just chime in. We're more than happy to meet one-on-one with you all and take a look at some of these. So Carly, would the best way be to email the data inbox and we can set up a time?
Yep, that's right. I'll put our link or email in chat.
Yeah.
But that is the best way, yep.
And same for you, Samantha, obviously, and anyone else who wants to walk through their report or has any questions.
The other thing, actually, Lauren, I might want to also mention, I know, in the regional meetings, I've been approached by a couple of counties who are using SurveyMonkey. So when they get their QA report and the longitudinal extract, it's kind of maybe a surprise, because this will be the first time that you're probably seeing a spreadsheet like that. So if there are counties who are interested in a walkthrough on how to review your data extract, please let us know as well, because you will not be resubmitting. I think there was a question about resubmitting via SurveyMonkey. The corrections need to be made, in that spreadsheet form. So that translation will, maybe a bit jarring if you are used to submitting data via SurveyMonkey, but you're seeing your data in a completely different format. So just wanted to mention that as well. And I know our team is trying to puzzle through, I think it's Eagle, I'm not sure if I said your name right, your question, and then Sam as well as your question. So it looks like they're going to be doing a little bit of investigation now that they know which county you're from, and then we can certainly follow up with you all on those questions.
Okay. Well, we do have a couple more minutes, so we're happy to stay on and answer any additional any additional questions that anybody has. And we hope everyone found this helpful. Again, recording and slides will be up soon, and we do have office hours this afternoon for anyone interested in continuing the conversation or have any other questions.
Can I ask Santa Clara County very quick regarding the question that just been asked? Do I pronounce it right? Eagle, right? EGLE.
Glenn Yarovic, that's okay.
Sorry, yeah. Are you referring to the comment regarding the monthly reporting comment? Monthly data is a requirement. Are you referring to that comment or? Or I would say inside the QA report, can you? I'm just wondering, is that the comment that you want to know what is happening or?
No, we have a comment that says that there's no data reported, I think.
Oh, okay. Got it.
And when we go to the actual original file that we submitted, we see data in that cell.
Got it. Okay.
Yeah.
I will take a close look at it, and then once I found it, I can write you an email. Yeah.
Yeah. Okay. Yeah. Specifically, actually, it's the data point 3517.
3517.
Mhm.
Got it. Right. Yep. I can take a look at that.
Thank you.
Thank you all for joining us. Hope to see many of you at data office hours later today. And again, on the 19th, please let us know if we can be helpful in any way. caredatateam@healthmanagement.com. You'll get an email once these slides and recordings have been posted. Thank you so much for joining us.